Thank you, Chairman Carter. And thank you, Vice Chairman Dunn. Thank you, Ranking Member DeGette, and members of the committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year budget for 2026. Debilitating disease, contaminated food, toxic environments, addiction, mental illness affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, to make America healthy again with a special focus on ending chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to over 100 million Americans who rely on Medicare, Medicaid, and other HHS programs. Third, to achieve these goals while cutting costs for taxpayers, we intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developed nation, and yet we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita to comparable nations. Clearly, something is structurally wrong with our approach. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. This is unsustainable. If we don't staunch this trend, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve the legacy programs like Medicare and Medicaid and the foundation of the MAHA agenda. Vulnerable populations, seniors, and veterans deserve consistent access to care, and I will make sure they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary care physicians. We will prioritize these families, especially Native Americans and Alaskan communities. We will protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not only the most effective, but also the most compassionate in U.S. history. While our official budget statement outlines many priorities, I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for a Healthy America. AHA will oversee initiatives such as Prevention Innovation Program, which targets chronic disease and childhood obesity through access to nutrition service and physical activity and reducing dependence on medication. Third, we will equip FDA to expand its food safety efforts through research, regulation, inspection, and education, to remove harmful chemicals from food and packaging and explore how to close the generally recognized as safe with a GRAS loophole. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to address their needs. 6, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we are using this technology already at HHS to manage healthcare data more efficiently, securely, and to increase the speed of drug approvals. Finally, we will rebuild public trust that eroded through the years of industry capture, waste, and misplaced priorities. We will launch a new era of transparency and public service, creating an honest, science-driven HHS that answers to the President, to Congress, and to the American people. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again. Thank you, Mr. Chairman.
Thank you. The gentleman